Hello everyone and welcome to this tutorial about the legislation surrounding medication administration within Australia, a very important tutorial. Okay, the objectives of this tutorial will be to discuss the legislation. We're going to have a look at the different drug schedules and what they mean. And we'll have a look at medication terminology and some abbreviations that are common with medications. We'll look at the different classifications of drugs and we'll look at your scope of practice. We'll have a discussion around your scope of practice when administering medications. Okay, so there's legislation that covers drug administration, okay? So drugs and medications are the subject of very detailed legislation and strict guidelines. So health professionals must be licensed by a range of professional bodies to prescribe, dispense and administer medications. So nurses are registered health professionals and they're licensed by AHPRA, Australian Health Practitioners Registration Agency. But this can become very difficult with respect to aged care workers, including primary health carers, because you're increasingly needed to play a support role when administering medications in aged care, but you're not actually licensed to do so, okay? So this can be very complex, and there's no legislation that covers yourself or the patients or the employer when it comes to administering medications as a carer in an aged care setting. Okay. So the current approach to your role as a personal care worker with medication is based on a best practice framework. Okay. And the essential elements of the framework include that you have appropriate training to be able to administer medications, which is why you're doing this course now, that you're subject to annual reaccreditation, that the workload is appropriately delegated, so if there are any high-risk medications, a registered nurse would do that. It's also that there's an element of supervision and accountability and responsibility for administering these drugs. Okay. Other essential elements of the framework include the aged care standards and the community care common standards, which reference medications, and the State Health Department guidelines and requirements. So, medications and drugs are subject to legal controls and control through policies and procedures within each health organisation, and these are obviously subject to national legislation as well. Examples of this legislation include the Aged Care Act 1997, okay, and the associate regulations, the Drugs and Poisons Acts and other relevant state and territory legislation. There's also the Disability Services Act 1986 and the Australian Pharmaceutical Advisory Council, or APAC that it's referred to. Their guidelines for medication management in residential aged care facilities. So as you can see, there's a plethora of legislation that needs to be adhered to in order to be able to administer medications in an aged care setting as a carer. You need to be aware of these. Okay. Now let's move on to talking about drug schedules. Okay, so drugs and poisons are classified by law into different schedules. Each schedule describes in general terms the properties of substances that would fall into each area. Okay, so drugs are placed into a particular schedule according to their level of toxicity, and aspects such as personal use, the potential for abuse, safety in use, and the need for the use of the substance. Okay, and there's different schedules ranging from 1 to 10, but the poisons or therapeutic drugs that you're more familiar with will come under schedules 2, 3, 4 and 8, so we're going to focus on these for the purposes of this tutorial. So an example of a Schedule 2 drug. Okay, so Schedule 2 drug is a drug that may be bought over the counter at a pharmacy without a prescription. Some Schedule 2 drugs are also available in supermarkets as well. So you could go to Woolies or Coles and you can pick up some Panadol or paracetamol. Okay, this is a good example of a Schedule 2 drug. It means it's relatively low risk, and you can readily purchase this drug. An example of a Schedule 3 drug is a drug that can be acquired from a pharmacy without a prescription from a doctor. So this means you are able to go to a pharmacy and purchase this directly from a pharmacist. You will need to speak to a pharmacist, but you do not need a prescription. An example here is Asmol. Okay, so this is an inhaler. Some people refer to it as a puffer, and this is to treat asthma or asthma attacks. Okay, so it's a salbutamol inhaler. Okay, now an example of a Scheduled 4 drug. So a Scheduled 4 drug is prescription only drug. Okay, there are also restricted Scheduled 4 drugs. Either way, Scheduled 4 drugs must be prescribed by a doctor, and they're substances that are referred to as restricted drugs. Okay, so one example of a Scheduled 4 drug would be diazepam. And as we move up the schedules, we come to a Scheduled 8 drug. Okay, these include drugs of addiction or potential addiction, and we refer to these in the medical world as controlled drugs or dangerous drugs. Okay, and some common examples of these are morphine and fentanyl. Okay, and they're very restricted, and it's often 2 registered nurses that need to be present when administering these in an acute setting. Okay, so I've included some information about medication terminology. Now there's lots of terms that you need to become aware of for your reference. So without me going through each and every one, there is a PDF file included where you are able to print it off and read about these in your own time. Okay, so I'll go through some important ones with you. So analgesic is a drug or medication given to relieve pain without the loss of consciousness. Anaphylactic reaction you may have heard of, and this is a very serious acute reaction which is caused by exposure to a toxin. So you may have heard of people being allergic to peanuts and they have an anaphylactic reaction. This is a medical emergency. Okay, so we'll be aware that people have allergies because this will be documented on their medication chart, and we'll talk about that in the appropriate tutorial. So please print this slide off and read through this in your own time. And the same with this one as well. Okay. And there's some common medication abbreviations. Okay. So I'm sure you've understood by now, if you've already been working in the healthcare sector for some time, but that there is a different language that we use. And we like to use a lot of acronyms. So here's a few of the acronyms that we use. I'll talk to you here about POS. Actually, this is PO, which means by mouth or orally. And this is how it would refer to how a drug can be administered. PO means orally. PRN means as required. What else? Daily. Once a day. OD. Okay, sustained release means that it's slowly released in the body. It may have an enteric coating, a tablet, for example, but it's released slowly. Okay, so I'll let you read through these in your own time as well. And these ones as well. So we've got different classifications of drugs. So I've already mentioned analgesic, it's pain relief. Okay. Opioids, here we've got very strong pain relief, and an example can be morphine. Non-steroidal anti-inflammatory, an example of that would be naproxen, or ibuprofen, or aspirin. Okay. Then we've got antibiotics, and they are used to treat bacterial infections. Anti-diarrhea, to stop diarrhea, self-explanatory. The anti-inflammatory, reduce inflammation, such as aspirin. Okay. Anthelmintics, they're there for the treatment of intestinal parasites. So Combantrin, so they're to treat worms. Antipyretics reduce temperature, so an excellent antipyretic is Panadol, paracetamol. Anticoagulants prevent thrombus formation, so they prevent clots. Warfarin is a good example of that. Antidepressants reverse depression. Antihypertensives will reduce blood pressure. Anti-epileptics will prevent epileptic fits. And antifungal agents will treat fungal infections. So a lot of these start with the word anti. Anti means that it will do the opposite, okay? I'll let you read through the rest of these drug classifications, and we also have separate tutorials going through the specific, through important types of drug classifications. So it's important to be aware that when handling drugs and poisons in the healthcare setting, there are a range of health professionals involved. And it's important to note the distinction in the difference between the health workers involved. So medical practitioners or doctors, they are the ones responsible for prescribing the drugs, okay? Pharmacists who work in the chemists or the pharmacists in the hospital, they're the ones that dispense the drugs. They would check the prescription and then they would dispense it. In the hospital setting or the acute care setting or the aged care setting, it would be nurses and others, such as yourselves, responsible for administering the drugs that have already been prescribed, dispensed, and it's up to the nurse or the carer to administer the drugs. Okay. So what is your scope of practice in the workplace with regard to medication? Okay, so personal care workers need to be very clear about the limitations of your role. Okay, you need to be aware of what your scope of practice is, and for that you need to refer to your local policies and procedures that are set by your employer. But you may be required to undertake common tasks in the medication role, such as assisting clients to self-medicate. You may be assisting them to take their medications. You may be responsible for preparing the medication trolley. It may be your role to provide physical assistance to clients. And it may be your role to observe changes in a client's condition. And it would also be your responsibility to report any changes in a client's condition to a supervisor. Okay, thank you for listening to this tutorial. I hope you learned lots about medication. Thank you very much.